So we were able to, in addition to having that put through, we were able to do what's called the fast track approval process for the FDA. Prior to ACT UP, the average time to get approval for a new medication was 3 years. The fast track approval process has cut that down to 16 months. And this was us going to the government, going to the federal government, going to the FDA headquarters and protesting and bringing thousands of people and making noise and screaming and bringing media cameras and bringing CNN and bringing the reporters and saying, we are dying. This needs to be faster. So now fast track approval process takes drugs that have an important role in public health and allows the manufacturer to expedite the process so that the drugs are available more rapidly. And an impact on this that's relevant today, Tamiflu, the medication that's used to treat H1N1 flu, is an antiviral medication. This medication was developed as a direct result to the research and development of HIV medications. The fact that this medication was available as rapidly as it has been is a direct result of activist work. The photograph on my right is from an action, what we called our events were actions, an action called Day of Desperation. On January 23rd, 1991, we decided that we were going to draw attention back to people living with AIDS. At this time, we had just launched war against Iraq, and the federal government was able to mobilize overnight hundreds of thousands of soldiers, tens of thousands of planes, automobiles, tanks, to the other side of the world. And we said, we need this type of reaction home. We need to have people here at home remembering that there are people at home who are still living with and dying from AIDS. So Day of Desperation was designed to cause, there's no easy way to say this, but basically to make it a bad day for everybody living in New York. And we wanted them to remember that there were people living and suffering with AIDS and people still being infected with HIV. And we wanted to draw attention to that. We had a series of actions. The one that I was part of was taking over the evening broadcast of the McNeil-era NewsHour. The other action that was closely linked to that was taking over the CBS Evening News. And there's video footage available on YouTube, and it's actually quite funny. You see an activist going with a sign saying, we called him the Energizer Bunny because he was just popping up in the sign. You don't realize it when you're doing the news that you're at a podium and it's a higher level for the camera, so it just looked really funny. But the biggest, the denouement, was the action at Grand Central Station. And we wanted to draw attention to the fact that every 8 minutes, somebody was dying from AIDS. And we wanted to have people aware of this as they were getting in their trains, going back to Connecticut, going back to their homes on Long Island, going back to their comfortable lifestyle, that this was a part of their life. We wanted to remind people that this was just not an abstract disease, but that this did impact their lives. And so we continued protesting. In 1987, there were over 100,000 people living with HIV. There was one medication, AZT. AZT cost approximately $25,000 a year. It was extremely toxic. It was so toxic, in fact, that when it was first developed as a chemotherapy agent, the FDA decided not to use it because it caused anemia at the doses required to be useful, efficacious. So this was the one medication that was available. If you could get it, because it was in such short supply and was available mostly only through clinical trials, if you could get it, your insurance wouldn't pay for it. Well, AIDS is a pre-existing condition. So why should we pay for something? And besides, you're not going to live long enough anyway, so we're just going to keep denying you coverage to pay for it. So if you could get AZT, your slightly better. If you couldn't get AZT, you were much worse off. AZT was the start of what was called monotherapy, or using one medication. The medications that we use now are what is called HAART, highly active antiretroviral therapy, and they generally consist of 3 or more medications, 3 different types of medication that virologically attack the virus at 3 different entry points and keep it from replicating. So this was the beginning. I talked a little bit about the graphics that we use, and I always like to use some of these graphics when I'm speaking because I think they're so profound. You get this. You get that in the United States that what there was 1 death every half hour. People in prison had a much higher rate of HIV infection. People in prison still have sex. Everybody knows it, except the prison officials. Nobody wants to talk about it. People in prison still have access to drugs. They still have access to the equipment to be able to tattoo, and they still have access to share needles. So we were trying to draw attention to the fact that people who were in prison had a disproportionately higher rate of HIV infection. And not only that, but when they were released from prison, more often than not, they weren't given medication in adequate supply to sustain them. And it's important to remember that even though there was only 1 HIV medication at this point, we did have medications to treat what are known as opportunistic infections of HIV/AIDS. So for example, we could treat pneumocystis pneumonia, we could treat different fungal infections that were generally, if not dangerous, if not deadly, to people living with HIV. This poster is from 1991. In 1991, activists were talking about the idea of universal health care. Well, a lot of us have been talking about that for far longer. We were also talking about a national AIDS strategy. I'm very proud to stand before you today and say that there is in the works right now a national AIDS strategy, thanks largely to the work of President Obama. The Office of National AIDS Policy, which is headed by Jeff Crowley, has been seeking public comment to develop a national AIDS strategy. Now, why is this important? Well, this is important because this is still a communicable disease, and it's a very contagious disease. And if we have a strategy as to how we're going to treat it, then we can begin to put this in place. So there has been some fantastic change. This was designed by Keith Haring. Keith Haring was a very popular, very well-known artist who unfortunately died from AIDS, but he was also an ACT UP member, and he designed this, and he did an amazing amount of work for ACT UP. His support through selling artwork it kept us going. It allowed us to pay for lawyers, it allowed us to travel to demonstrations, it allowed us to feed people at times. It was just absolutely incredible. We also did education. We told people how you do and don't acquire HIV, and that kissing was not something that allowed you to get HIV. There was such incredible opposition to doing any kind of sexual health education beyond just pregnancy prevention at the time that no one was talking about, well, how do we prevent sexually transmitted diseases? People aren't comfortable talking about sex in America. That's part of our history. That's part of who we are as a people. We had an ongoing battle with John Cardinal O'Connor, the Archbishop of the Diocese of New York. The Catholic Church in New York has an inordinate amount of political clout, and this is the great dichotomy. On the one hand, you had Cardinal O'Connor saying, we're not going to allow you to talk about condoms in any kind of public education form, we're going to boycott magazines and newspapers if you put safe sex ads in them. We're going to lean against the MTA, the Metropolitan Transit Authority in New York, if you put safer sex advertisements in subways. We're just going to make this very difficult. And over here, you had St. Vincent's Hospital, the only hospital in New York City that was actively caring for people living and dying with HIV.